Access to healthcare in rural settings is a matter that is seen commonly within the United States. Those in rural areas are more likely than their urban or suburban counterparts to be obese, smoke, or be diagnosed with cancer, diabetes, hypertension, or respiratory disease. Leaving these diagnoses uncontrolled can and will likely lead to target organ damage as well as other detrimental effects that should be addressed immediately. As the advanced nurse practitioner, we will diagnose, treat, and educate on illness and disease. This discussion will highlight potential barriers such as transportation, financial burden, healthcare bias, and provider shortage while providing insight on ways to increase health promotion, disease prevention, and overall health of those in the rural communities. A rural area is any population, housing, or territory that is not in an urban area. An urban area, according to criteria, must encompass at least 2,000 housing units or have a population of at least 5,000. Patients ultimately avoid seeking care unless they are physically ill. This leaves healthcare professionals, including nurse practitioners, at a greater disadvantage when it comes to healthcare delivery. When hospital visits are required, most individuals must travel outside of their community for services, and when transportation is not readily available, there could be a burden placed on patients to get to and from appointments. The financial strain this could place on patients could also be a determining factor in their care. Most rural areas encompass high poverty and unemployment rates. Not only are there workforce shortages, but also inadequate facilities. Within smaller communities, there are a limited number of providers due to a geographical location and the number of jobs readily available. These facilities are more likely to be smaller, with shorter hours of operation, and are inadequate to perform diagnostic tests such as MRI or CT. Individuals unable to afford health care are at an increasingly alarming rate for chronic disease, mental health concerns, and detrimental health outcomes. Ethical considerations are very important. If a medical emergency is to arise due to course of treatment, the nurse practitioner could be held liable or placed at fault for medical error by misdiagnosing or from potential side effects that were left untreated by missed follow-up appointments. Confidentiality is another ethical consideration to consider. If you reside in the community you currently practice in, this could leave room for judgment that the patient's personal information will be shared from others. Patients could also withhold important information from a judgmental standpoint. This affects the patient population directly. While seeing an increased patient load is beneficial within advanced nursing practice and the barriers that have been discussed, it can hinder care if patients are unable to follow up with their providers or complete diagnostic testing that are in place to help prevent disease progression. A mobile health clinic is a great resource that could greatly impact the rural community, especially those who are homebound or have unreliable transportation. Providing access to health care within the communities can further increase health promotion and provide the opportunity for education on maintaining a healthy lifestyle, implementing diet and exercise, as well as mental health screenings. The use of social media and community-based teachings through employment agencies, as well as the school system, is a great way to knowledge share on vaccinations, preventative screenings, and management of chronic conditions. My final suggestion to improve healthcare in the rural area is to implement telehealth services. This is not only easier for the patients who experience barriers to healthcare, but these technologies enable healthcare delivery without direct contact, thus reducing infection risks. As you can see from the few points of discussion, there are significant barriers to healthcare in the rural setting. While this burden is known worldwide, we must determine and incorporate ways to improve the health of individuals throughout the lifespan with the resources we already have available. It is of the utmost importance as healthcare providers to decrease the burden of receiving care within these smaller communities. I've provided 2 questions to further this discussion on this topic and would greatly appreciate your input and suggestions. Thank you.